see. Let's see. Okay. If you know anybody that is interested in becoming a nurse, thought about being a nurse, on the fence about being a nurse, has questions, already in nursing school, need a little bit of assistance, need a little guidance, need a little coaching, send them over to the page that is tagged in this live. I tried to go live on Instagram too. Did y'all know that you have to have at least 1,000 followers to go live on Instagram? I had no idea. I don't have enough friends. I had no idea. So I can't go live on Instagram. So I'm probably gonna have to make another TikTok page for this nursing stuff. All right. I only have 7 minutes before my daughter gets out of her cheer practice. So let me just answer a couple of questions. Top 10 questions, frequently asked questions about from people that are curious about nursing or nursing school. Hey, if you have anybody that is a nurse, interested in being a nurse, thought about being a nurse, on the fence, send them to my page. Okay, so how long does it take to become a nurse? So it depends what nurse. If you want to be an LVN or LPN, that's a licensed vocational nurse, or a licensed I don't know what the P stands for right now. Licensed vocational nurse. That can take about a year, 12 to 18 months. RN, if you get your associates first, that will take 2 years. If you go into a 4-year program, obviously that's going to take 4 years, but you're going to graduate with your bachelor's. When I was in nursing school, I started out with going to get my associates first. So that took 2 years, and then a year into the program, the LVNs joined us. So they were already LVNs. They came into the program a year in, and they finished their associates in a year. What's the difference between an LVN and RN? So LVN, they're still nurses. They're still licensed nurses, but they can't do everything an RN can do. They have to work underneath the RN. They can provide basic care. They can give meds. They can give IV pain meds, but the RN has to start the IV pain meds first, or IV meds first. The LVNs cannot perform assessments. RN has to be the one to perform assessments. Is nursing school really hard? Yes, it is really hard. One of the hardest things I've ever done. Can it be done? Yes. Of course it can. With dedication, sacrifice, hard work, studying. But it's hard, but it should be hard. It honestly should be hard, because I'm a RA. We ain't talking about that kind of RA. We're talking about a registered nurse. But nursing school should be hard, because you're getting out of school and you're going to work with patients. You have these people's lives in your hands in many cases, so it should be hard. How much do nurses make? It just depends. It depends where you are located. I know a lot of times northern states make more than southern states, but I already knew what you meant. But where I'm located, I work in the Houston area, so we nurses here, we make pretty decent money. What are the nursing school prereqs? It just depends where you're going. Where I went to school, you had to have all your core stuff, your English, math, science, history. But for nursing school specifically, you had to have all that plus A&P 1 and 2, anatomy and physiology 1 and 2, and you had to have math, but not just like college algebra. This school requires statistics and chemistry. I hated every bit of statistics. I hated every bit of chemistry. Hated it. She just no, I didn't say that. Don't call me big money. Don't call me big money. If you saw the meme I shared on my page, run. Don't please don't call me big money. Ladies, if a man calls you big money, run. What's the NCLEX and how hard is it? The NCLEX is the national exam that you have to take once you graduate. Once you graduate, you're not just automatically a nurse. You have to graduate and you have to take your state boards. That's the NCLEX. You have to take it and you have to pass it. How hard is it? It is extremely hard, but that's what test prep is for. I am offering test prep. I can help you study for your NCLEX. I took it one and done. I did not have to take it multiple times. How do you know if nursing is right for you? Well, you have to get in there and you have to see. You won't know until you try. I didn't always think I was going to be a nurse. I didn't graduate nursing school until I was 30. I already had 2 kids by then. You have to at least get in and start and see. I also went into nursing school thinking that I wanted to work in the NICU. That's with neonatal ICU babies. And I got into nursing school and I did my PD clinical rotation, and then I realized, oh no, I don't want to work with kids ever. So you just won't know until you try. You won't know. What's the best type of nursing to get into? I can't really say that there is a best type because there's so many different types of nurses. You have to try different things. I started out my nursing career as a med-surg nurse. That's working with a wide variety of patient populations. You see a little bit of everything. These patients are sick enough to stay in the hospital, but they're not so sick that they have to be in the intermediate care unit or the intensive care unit. But you get everything. Then I went to day surgery, pre-op and post-op. These are patients that are you're getting them ready for surgery, and then you're getting ready to send them home once they're out of surgery. And then I went to interventional radiology. Now I'm doing interventional pain medicine. Like, there's so many different avenues for nursing. You have to just try different things and find your niche. Can I work while in nursing school? You can. It's not recommended. If you can get away with not working, you probably shouldn't, because it's going to require a lot of your time. It's going to require, you're going to be in school every day of the week. And then once you start clinical, you're going to be in clinical outside of your school hours. So it doesn't really leave a whole lot of time for you to work. I personally worked part-time during nursing school. I went to school Monday through Friday, and then I worked part-time as a PCA or CNA at the hospital on the weekends. If I had a choice of not working, I wouldn't have, because I was going to school, working, and I had 2 kids to tend to. I knew a couple people that worked full-time jobs. Was it extremely stressful? Yes. So I wouldn't if I didn't have to. But that's really it for now. My daughter's getting out of cheer practice, so go over to my page, follow it. Send somebody you know that wants to be a nurse, thought about it, interested, not really sure, on the fence. Everybody's welcome. Send them to the page. All right, take care.